I think there's an awful lot to be learnt from the successes and failings of alcohol and tobacco policy. Clearly, there's an awful lot wrong with alcohol and tobacco policy, and I think it's entirely consistent with calls for better regulation of, or any regulation, legal regulation of currently illegal drugs, to also call for better regulation of alcohol and tobacco, and that's something that we at Transform do and have done consistently since the outset, is call for better regulation of alcohol and tobacco. So we support the ending of sponsorship of sports and music events, generally the ending of promotions and advertising more broadly. We support minimum pricing controls. We support a whole range of the sorts of regulatory models that we're calling for illegal drugs to be applied to alcohol. Alcohol in the UK is a particularly bad model of practice. Clearly the industry has got far too much sway with government. There's a certain degree of corruption. The government doesn't really want to go there. It's not going to be very popular to put the price of booze up with their electorate, and so on and so forth. So there are a whole series of practical and political problems in terms of alcohol reform. But I think it's interesting if you look at tobacco reform, that has been, I would argue, a reasonably good model of progress. But the difference is it's coming from a different point. You're coming from an unregulated free market as opposed to an unregulated criminal market. But if you look at tobacco over the last 20 years, we've seen bans on advertising, complete bans on advertising. We've seen bans on smoking in public places. We've seen dramatic price increases. We've seen age of access has increased recently from 16 to 18. We've now seeing health warnings on packaging. We're seeing, looks like they're going to introduce storefront display controls and restrictions. So, and all that has actually contributed to a sort of 30 to 40% drop in tobacco consumption over the last 20 or 30 years since its peak in the 70s. And that's all been achieved without criminalising any users and without abdicating the market entirely to gangsters. So we've seen substantial public health gains and kind of increasingly healthy social norms around the general unacceptability and of smoking without having to resort to harshly enforced blanket prohibitions, but instead using sensible public health driven regulatory models. So I take some lessons from tobacco. We'd like to see similar lessons applied to alcohol, and I think we can learn from the failings of both of those policies and apply them to illegal drugs. And actually there is going to be convergence around optimum regulatory models rather than saying, look, if we legalised other drugs, look what would happen. I don't think that would, because actually we're increasingly tightly regulating alcohol and tobacco too.